strike to other health workers also agitating for better welfare. Immunization efforts suffered a minor setback with vaccine shortage recorded in the last quarter of the year. And despite increased funding of polio eradication activities, no cheering news yet. Nigeria remains one of the most entrenched reservoirs of the virus. From 62 wild polio virus cases in 2011 to over 100 cases in 2012. Right now, Nigeria leads other countries on the global polio cases chart with a total number of 24 cases recorded so far.
22 states in Nigeria have not had a case of wild polio virus in more than 2 years. Those 22 states, if they were countries, they would have considered to eradicate polio. The remaining states where we've had children being paralyzed by polio, the paralysis happened in very few local governments within those states. Almost 85% of the cases of wild polio virus in 2012 are in local governments that are considered high risk, and the 15% are in their neighboring local government areas, meaning that we have successfully localized the wild polio virus, and this is despite the challenges we've seen in states like Borno and Yobe.
In terms of threat, I'm still trying to arrive at one specific item that he has been able to do. You see, you're talking of health indices. You want to ask me, has our indices improved? The mortality ratio of women, has it improved? I can't just pick much from the health area from my president. What we are praying now is that after this Boko Haram issue, she ought to settle down and address the health issues.
The National Health Bill is one document Nigerians are waiting to see become law, passed by the Sixth National Assembly in 2011 and sent to President Goodluck Jonathan for his assent. The bill was returned to the National Assembly by the President for further amendments, perhaps owing to agitations from some stakeholders in the health sector.
Every day that passes, millions of children, millions of Nigerians, millions of pregnant, thousands of pregnant women are dying from avoidable deaths. And the National Health Bill, especially in Clause 11, seeks to, of course, make free provisions for health for our people in rural communities at primary care level, where over 70% of the disease burden of Nigeria exists.
Indeed, Nigerians expect improved healthcare delivery from the federal, state and local governments and will be looking forward to what more the government has to offer in the remaining 2 years of the Goodluck Jonathan administration. Yomi Otaigbe reporting for Channels Television News.
Still ahead on the news at 10, more on the performance of the administration in the health sector. I'll be joined by the President of the Pharmaceutical Society of Nigeria, Mr. Olumide Akintayo. Join us again.